Well, good afternoon, everyone, and thank you for being with us. Before we begin, I'd like to acknowledge that the lands on which we gather are the traditional territory of the Mi'kmaq, Abiguit. They are the past, present, and future caretakers of these lands. Bonjour tout le monde, moi je m'appelle Sean Casey, je serai votre maître de cérémonie pour cette annonce aujourd'hui. C'est une annonce où on a le ministre de la Santé du Canada, l'honorable Mark Holland, et aussi le ministre de la Santé ici à l'île de Prince-Édouard, Mark McLane. Cette annonce est vraiment un indicateur du niveau de collaboration entre les deux niveaux de gouvernement sur le dossier de soins santé et quelque chose qui est tellement important pour tout le monde ici à l'île de Prince-Édouard et partout au Canada. I'm very pleased to be here with you today for this important update about the progress we have made through Prince Edward Island's PharmaCare bilateral agreement. It is my great pleasure to welcome to Prince Edward Island the Honorable Mark Holland, Federal Minister of Health. And he'll be more formally introduced in a few minutes. But I'm going to call to the podium now the Minister of Health and Wellness for the province of Prince Edward Island, the Honorable Mark McLane. Minister McLane was elected as the MLA for Cornwall Meadowbank in November 2021 by-election and again in the 2023 general election. And this, my friends, was no small feat, given that riding had been Liberal for 36 years before Minister McLane arrived on the scene. He was appointed the Minister of Finance in July of 2022 and served as a member of the Standing Committee on Education and Economic Growth. He understands the need for permanent systemic changes to make PharmaCare more accessible for everyone, and he'll address that in just a few minutes. After we've heard from all our speakers, there will be a media question and answer session, both here and online. We'll have Ron Ryder coordinate all that. But without further ado, the Minister of Health and Wellness for the province of Prince Edward Island, the Honourable Mark McLane.
Thank you, Sean. Minister Holland, advocates for health care and health professionals, good afternoon. It's a pleasure to be here today to touch base with those of you who have helped to guide and advise us as a government delivering support for more affordable prescription care on Prince Edward Island. Prescription costs can be a significant burden for many people, and Islanders have told us that their prescription costs make it challenging to manage their household. We want to lighten that burden and assist in making sure people that are receiving care that they require. And the Government of Canada has been an important partner in that work. Today, I'm happy to provide an update on the great success of our provincial $5 copay program launched in June of this year. P.E.I.'s $5 copay program expands provincial drug coverage for cardiovascular disease, mental health diagnosis, and diabetes. It reduces copay to $5 for almost 60% of medications regularly used by island residents covered under the seniors, diabetes, family health, and generic drug programs. Since the program was launched just over 2 short months ago, P.E.I. residents have saved an estimated $675,000 in out-of-pocket costs on more than 77,000 prescriptions. This is money that goes right back into the pockets of seniors, families, and those who are uninsured. These are people who contribute to the island economy, work hard for their money, and deserve to get good value from their paychecks and pensions. We are continuing to modify and expand our support for prescription care in this province. Last month, P.E.I. also improved the high-cost drug program to remove barriers for those in the lowest income brackets and to make the program available to all income levels. We have also improved the catastrophic drug program to lower the annual cap on the amount of money a household spends on eligible medications. Under the catastrophic drug program, those enrolled now spend no more than 6.5% of their household income on prescription drugs, compared with 12% in the past. We understand how important it is to ensure people are able to afford their medications and continuously looking for ways to improve our existing programs to benefit Islanders. And we will work with our community partners to develop and deliver programs that make healthcare more affordable and accessible for Island residents. Affordable drug coverage with a strong federal funding partner has improved access and reduced financial burdens for people. It has helped ensure that Island residents have better access to prescription medications they need most. In P.E.I., we are always looking at ways to expand our formularies and make medications more affordable for our residents. Since the IAPD was signed, we have added 85 medications to our provincial drug program. We have also reduced the burden of paperwork on doctors by removing the special authorization requirements on many needed medications. We are talking about medications that are used to help people with cancer, with diabetes, and with heart conditions. We have supported funding for medications used in the treatment of mental health and addictions with our substance use harm reduction drug program, which provides free opioid and alcohol dependency medications to Island residents who need them. We know there's more to do, and we are committed to improving care for Island residents. It's important to recognize the Islanders who take the time to speak about their situation, especially about the changes that can help them and others. Thank you for your feedback. And of course, it is important to recognize employees and community partners who make healthcare possible. I look forward to our continued collaboration between governments and health professionals to ensure pharmacy care and to continue to make it more accessible for Island residents. Thank you very much.
Thank you very much, Minister McLane. It's now my honor and privilege to introduce to you my friend and colleague, the Honourable Mark Holland. Minister Holland is the Member of Parliament for Ajax. He was first elected at the ripe old age of 29 in 2004, re-elected in 2006, 2008, 2015, 2019, and 2021. He has served as the Parliamentary Secretary for Democratic Institutions, as the Parliamentary Secretary to the Minister of Public Safety and Emergency Preparedness. He also sat in the lucky seat beside me before he was elevated to cabinet. But before that, spent the entire pandemic as the Chief Government Whip, then the Government House Leader, and now Canada's Minister of Health. He is someone that has broad respect on both sides of the aisle and is someone who is passionate about politics and passionate about what it takes to move the country forward. And we are undoubtedly going to see that in spades during his tenure as Canada's Federal Minister of Health. It's an honor and privilege to call him a colleague, and I welcome him to Prince Edward Island and invite him to address you. Minister Holland, please.
Well, thank you so much, Sean. It is an absolute pleasure to be here today. And maybe I'll just start by thanking Sean Casey for the incredible work he does. One of the most powerful voices for better health for Canadians is our chair of the Standing Committee on Health, somebody who has fought tirelessly not only for the residents of Prince Edward Island, but for all Canadians and for better health outcomes. So it's an honor to be with you here today, Sean. Let me also say how much I appreciate the partnership that we have with Premier King and Minister McLane as we work together to create better health outcomes for Islanders and all Canadians. They've been an absolutely critical partner, and I'm going to speak for a second about that partnership more broadly, but I want to speak specifically what it means here for Islanders when we're talking about drug coverage. You know, we just had a great roundtable with some folks on the front lines of seeing the effects of these changes and frankly, more changes that we have to do. But what does this mean in a practical sense? Because you see Minister McLane talking about that huge number just since June, $675,000 being saved by Islanders. But what does that mean in a practical sense? Well, somebody's talking about a family, a husband and a wife, in a practical sense in the town hall. Mark, you were the one who was identifying it. Means $500 to $600 in savings. And that could be the difference between being able to make a choice about essentials like food or heat, and being able to pay for your drugs. And we know that nobody should be put into that circumstance. So this partnership is absolutely critical. And I mean, you also think about the fact that expanding the formulary, making sure that Islanders have access to more drugs, that they're on the same footing with other Atlantic provinces, that means that somebody walking, can now get that care at home. And get the drugs that they need at home instead of having to go to a hospital for those drugs, and what that means for the patient, or for a patient who otherwise wouldn't be able to afford those drugs that are absolutely critical for their health. So this is a huge movement. It's great learning as we look to improve health outcomes and with partnership with provinces and territories across the country. And it's an example of what partnership can do for us. We had a historic agreement back in February signed with Premier King and Minister McLane that's going to see $200 billion injected into our health system over the next 10 years that is going to vastly improve health outcomes for Canadians. And I'm looking forward, Minister McLane, to being here very soon to talk about the action plan and how we're going to work together to reduce wait times, to improve primary care, to make sure that people have the health care that they need. And of course, I'm very excited as Sean Casey has been advocating very hard for making sure that all Islanders have access to dental care. And we're looking forward to come back with important news about how that's going to work as well. Mais je veux dire rapidement quelques mots en français sur l'enjeu aujourd'hui. Depuis son lancement en juin, l'initiative de réduction de le counterpart à $5 de l'île de Prince-Édouard a déjà permis aux résidents d'île d'économiser plus de $675 pour des médicaments et des traitements qui sauvent des vies. En juin 2023, cette initiative a réduit la quote-part de près de 60% de médicaments qui sont utilisés régulièrement par les résidents d'île pour traiter les maladies cardiovasculaires, le diabète, les problèmes de santé mentale, couverts par les programmes des médicaments publics. De plus, le programme de couverture de médicaments aura également été modifié afin d'éliminer l'obstacle à accès au programme pour tous les résidents d'île. En juillet 2023, l'île de Prince-Édouard a modifié le programme de couverture des coûts exorbitants en médicaments afin d'abaisser le plafond annuel des dépenses des mélangés pour les médicaments admissibles. Ça, c'est tellement bonne nouvelle. Je suis tellement content d'être ici avec vous aujourd'hui. This is an incredible announcement, and it means real improvements. And I want to say that we know that Islanders not only deserve affordable and accessible medication, but they also deserve us to act in a number of other ways. And it's why we're taking historic action to lower drug prices, including new rules on patented drugs. We're investing more than $1.5 billion over 3 years in support for the first ever national strategy for drugs on rare diseases. And this, as I said, is foundational to our talks and consideration of a national pharmacare program. It's emblematic of what can be achieved when we work collaboratively with one another. I want to say to Minister McLane, thank you for the incredible work done by Premier King and your government on this program, and look forward to the incredible things we can do when we collaborate together. Thank you so much.
Thank you very much, Minister Holland. That concludes the formal remarks part of today's presentation. We're now going to hand it over to questions from the media, both here and on Zoom. And in that regard, we have with us a great Canadian and a highly trained professional, Ron Ryder, to coordinate. Ron?
It's quite an introduction. Thank you very much, member. We're going to now take questions. We'll begin with the media who are present with us in the room. Just ask you to use the standing microphone, state your name and your outlet. And I'd ask that the reporters please limit yourselves to one question and a follow-up. And you can use the official language of your choice. When we're done with the media present here, we will go to our friends joining us virtually. Thanks.
Hi, it's Cody McKay with CBC P.E.I. Question for Mark McLane. 675,000 has been saved so far, 170,000 Islanders. It's about $4 or $5 a person. Is that the math that sort of adds up, or is it certain amount of people who are eligible for the program?
Well, I guess my wife is a pharmacist. She could probably answer this question a little more adequately than I could. But again, with the copay program, again, the calculations is based on the savings that they've had over since we launched the program in June. So again, almost $700,000 in 2 months is significant. So I think going forward, we'll continue to look at it, and it's a great step forward to reducing costs.
You said you've heard a lot from Islanders about needing more, and you said that there's always room to expand. Can you elaborate on that?
Well, I think, I do get the odd request, again, to examine drugs that are on our formulary and which ones should be included. So that's a never ongoing process. It never ends, which ones we should consider. So we do get requests from either advocacy groups or actually Islanders that are looking for particular drugs to be included as we expand the formulary.
Thank you.
Thank you.
Hello, Teresa Wright. I'm a freelance reporter, and my question is for Mr. Holland. Ottawa is providing funding for medications in PEI, and the former minister called it a test model for pharmacare, for national pharmacare. The money is going to the provincial formulary, which is not what most Canadians think of when they think of universal pharmacare. Only some people would qualify for medications under that program, including people on social assistance. So is this the model that your government plans to use to fulfill the promise of a national universal pharmacare program?
Well, thank you so much for the question. And let me say at the onset, immediately now, we want to find ways to reduce the cost of medication, whether or not it's taking action to make patented drugs less expensive, whether or not it's the program we're doing here in PEI, whether or not it's working with our partners on finding ways to find economies of scale and purchasing. We want to reduce costs, and I think we're seeing that exactly here in PEI as rapidly as possible. I think it's fair to say that there are a great deal of lessons from the enormous success that we're seeing here in PEI that are going to be helpful in informing the conversation on a national pharmacare program. But that conversation is pan-Canadian. It's certainly happening in Parliament. It's happening in the Health Committee, which Sean Casey chairs. So that dialogue continues, and there are many inputs, of which this is one.
So is that the model that we plan to use?
I think it's important to say that the consultations and the information will determine what outcome is going to take place. We have legislation that is currently being discussed with all parties in Parliament, dealing with an act respecting pharmacare that can lay some of the foundational work that we need to do. So I don't want to be prejudicial to those discussions, but it's important we take a look at what works and what is efficacious. And I think that this program, which has been enormously successful, not just in its outcomes, but in how we partner and work with provinces, in this specific case with Premier King and Minister McLane, that is emblematic of the type of partnership and cooperation that we need to build in order to get this job done.
And just on another topic, Health Canada has published model practice standards for MAID practitioners that suggest that physicians and nurse practitioners should bring up unsolicited the possibility of MAID even for patients who might only qualify. I know that Health Canada didn't write these standards, but do you endorse that policy?
Well, yeah, I think at first I would just take you back to the fact that these practice standards are independent from Health Canada. They're made by experts. Their advice to provinces and territories, who are the ones that are responsible for the application of practice standards. What I could say at a high level is that we are having a continuing conversation in Parliament about how we make sure that we find the right balance on the issue more broadly, going up and above that. That we want to make sure that that folks who are in a state of incredible suffering, and we have that circumstance today where somebody is in an end of life circumstance, or where their health situation is in real deterioration and they have no prospect for an amelioration in their health circumstance, have an opportunity to die with dignity. But the practice standard issue is one that is administered at the provincial level on the advice of this independent group of experts. Sorry, are we going to Zoom or are we?
All right. Hi there.
Oh,
I'm Jack with CTV News. Can't hear me because I'm too tall. Couple questions for you, Mark. Yeah, so stay up there. These are from my national colleagues. We're seeing a rise in COVID-19 cases. Do you think that constitutes a surge? And if so, do you think emergency rooms are in a position to handle it?
So first of all, we're monitoring the situation very closely, obviously with EG5 and the various subvariants of Omicron. We're evaluating on a daily basis what the case count is and what the trajectory is. This is fully expected. We knew that as we lead into fall, that we'll see an increase in the case count. The critical thing right now is for everybody to get their vaccinations up to date, for people to take appropriate health precautions. But in terms of our readiness, we are ready and working with not only our provincial and territorial partners, but international partners on monitoring and are ready to take action as is needed as this situation evolves.
Great, and thank you for mentioning vaccines. The second question is, Peter Public Health saying a new vaccine that helps with the latest variant is coming in the fall. Given that, should people wait or should people get their shot now?
Well, we just saw a report that looked at hybrid immunity across Canada and showed that the practices and approaches that we've taken are incredibly effective, among the most effective in the world, and led us to have one of the lowest death rates in the world. In fact, it's estimated that using vaccines saved in Canada about 800,000 lives, which is incredibly significant. People should be keeping their vaccines updated, and the data and science as we move through this process are evidence of that. My advice is that people keep up with that regime. There will consistently be new variants, and we will consistently have new vaccines. So I think when you are eligible and able to get a vaccine, you should take it. That when there are new vaccines are available and it's your time, then that's the appropriate thing to do. But I don't think people should hesitate in getting vaccinated at any time.
Thank you.
Thank you, ministers. Thank you. I will just now go to our questions from the journalists participating via Zoom. Thanks.
Thank you. If you're a journalist on the Zoom and wish to ask a question, please use the hand raising function. Again, we ask that you limit yourself to one question and one follow-up, and please state to whom your question is directed. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Encore une fois, merci de vous limiter à une question et un suivi, et merci d'indiquer à qui vous posez votre question. Our first question, première question, vient d'Héloïse Rodriguez-Giselbach de Radio-Canada. Héloïse, à vous la parole.
Oui, bonjour. Est-ce que vous m'entendez?
Oui.
Okay, ma question est pour le ministre Holland. C'est une question pour ma collègue de Winnipeg. Le seul lieu de consommation de drogue supervisée à Winnipeg craint de devoir fermer ses portes d'ici la fin de l'année parce qu'ils vont perdre leur financement de Santé Canada. Leur seul espoir, c'est de soumettre un nouveau projet qui pourra peut-être être approuvé. Est-ce que vous pouvez nous assurer que ce programme ne prendra pas fin?
Pardon, c'était pas clair
C'est
pour
un
moi.
peu bruyant. I can try it in English, just in case you can hear me better, but Winnipeg's only supervised drug consumption site is afraid it's going to have to close its doors by the end of the year because it's going to lose its funding from Health Canada. Can you assure us that this program won't have to come to an end? What can you say about it?
Oui, je vais vérifier l'information. Je suis le ministre juste pour 2 semaines, mais c'est une bonne question et je vais vérifier l'information. Merci.
Parfait. Ma question de suivi, c'est sur ça aussi. Est-ce que pour vous, ce genre de service, c'est une priorité?
Oui, c'est absolument essentiel de s'assurer que le service est disponible pour toutes les personnes qui ont besoin de service. Et dans chaque instance, on va vérifier que l'aide est là. Et dans les circonstances spécifiquement à Winnipeg, je vais vérifier l'information et je vais répondre aussitôt que possible.
Merci beaucoup. Our next question comes from Tessie Sanchi of the Hill Times. Tessie, please go ahead.
Hi, thank you for taking my question. This question is also for Minister Holland. Minister, you mentioned consultations and discussions going on about pharmacare As far as I know, there is no formal consultation. So in terms of your ability to actually pass a bill by the end of this year, as per the agreement with the NDP, what can you tell us about formal consultations and when that information will be made public?
Well, thank you very much. And of course, we hear from Canadians all the time. The Health Committee, of which Sean Casey chairs, certainly has also its members been looking at this issue. And we are taking input from all Canadians and from stakeholders. It's a significant part of the conversation that I'm having as I'm touring the country and proactively reaching out to my counterparts and stakeholders across the country. And certainly conversations I'm looking forward to having with my critics. I've had the opportunity to have a detailed initial conversation. As I said, I've only been in the job for 2 weeks, but I was able to meet Don Davies in Vancouver, and we had a really good initial conversation around that potential legislation. My former counterpart, the House Leader for the New Democrats, and I had a good opportunity in Vancouver to discuss that as well. And of course, I'm talking with our current House Leader, Karina Gould. So there are conversations. For my part, they're more nascent in the role as Health Minister, just because of how recent I am to the role. But it certainly is our intention to proceed with legislation this fall.
Thank you. No follow-up.
Thank you very much. Last call for questions on the Zoom. Dernier appel pour des questions sur le Zoom. Okay, there are no more, so that'll conclude today's event. Thanks for your participation. Any additional questions can be directed to Media Relations at Health Canada. L'événement est maintenant terminé. On vous remercie de votre participation. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des Relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
Recording stopped.